Hi everyone. Today we'll be talking about childhood obesity. We'll be focusing on how beverage choices, specifically sugary drinks, play a significant role in childhood obesity and how education can help improve outcomes. Let's start with a quick scenario. Imagine you're working in a pediatric clinic and you notice many of your patients are dealing with health conditions that could follow them into adulthood. In fact, about 1 in 3 teenagers are affected by chronic health conditions. As of 2022, 33.4% of teens in SPA 4, the area in central Los Angeles, were classified as obese in the top fifth percentile. This highlights how widespread and serious this issue is and why early intervention is so important. With education, compassion, and early support, we can give families and their children tools to create lifelong health. One major issue is that many parents and guardians don't realize that drinks labeled as healthy, like fruit juice, can actually contain large amounts of sugar and excess calories. Because of this, children may be consuming more calories than expected, even when families think they're making good choices. By educating both children and caregivers about healthier drink options, we can reduce unnecessary calorie intake and promote better overall nutrition. This is a simple but impactful way to help address childhood obesity. Looking at the research, we can see how significant the problem is. About 19.7% of children ages 2 to 19 have a BMI at or above the 95th percentile, classifying them as obese. Additionally, sugary beverages are strongly linked to childhood obesity. And locally, about 35% of children in Los Angeles consume at least one sugary beverage every day. These numbers show just how common and influential sugary drink consumption is. It's also important to remember that children's knowledge about food and health is largely shaped by their parents and home environment, which means education at the family level is key.
We wanted to quickly touch on our core values, which we use to ground our intervention. These core values stem from our research and needs assessment in SPA 4. First and foremost, we prioritized health literacy by smogging all pre and post test questions to ensure readability. We also incorporated cultural humility by offering the intervention in both English and Spanish. From our needs assessment, we learned that almost 30% of the SPA 4 population has limited English proficiency, so it was very important to us to be mindful of literacy and language barriers throughout this project. Using a trauma-informed approach, we also avoided stigmatizing or judgmental language regarding weight and focused on creating an inclusive and non-judgmental environment. Demonstrating equity and inclusion, we provided the entire intervention in both languages and in an online format to help us reach a broader and more diverse audience. Finally, we emphasize advocacy through empowerment, supporting guardians in making informed decisions rather than placing blame. Now, let's talk about our intervention itself. The intervention consisted of 3 parts. First up was the pretest survey, which used SMOG questions to ensure readability at all literacy levels and assess participants' baseline knowledge about nutrition labels. Then we had a short educational video in both English and Spanish that teaches how to read and interpret nutrition labels in a clear, practical way. In this video, we share helpful tools to break down nutrition labels from complex and overwhelming to simple and easy to use. The final component of our intervention was the post-test survey, also SMOGed, which measures changes in understanding and confidence after the intervention. Together, these steps help us evaluate both knowledge and learning outcomes from our intervention. Next, let's go over our objectives of the intervention. Our goal is to improve both knowledge and confidence. Specifically, our goal was for participants to show improvement in their ability to read and understand nutrition labels, identify sugar content and key nutrients, understand serving sizes, and be able to classify nutrients as low or high. The picture on the right gives an example of what our survey questions look like, using pictures of nutrition labels on common beverages such as milk, Gatorade, Snapple tea, and Coke. Most importantly, our primary objective was to increase confidence in reading nutrition labels, so participants feel empowered to make informed choices and to teach others. This was directly connected with our advocacy core value because by teaching one, you teach many, highlighting the ripple effect of health education. Next, Taylor will present the outcomes of our intervention.
Thank you, Margaret, for the project overview. Now that we've introduced our measurable objectives tied to our survey, we will be walking through the results of our project. We will first cover the objectives that we met, what follow-up will look like, and some nuances within our results. First, we'll go over objectives 1 and 5, where we assess participants' confidence in reading nutrition labels and teaching others how to read them, since confidence is a key first step toward behavior change. We looked at overall trends in confidence, knowledge, and application-based skills. As you can see, there was a marked increase in overall confidence in both categories, in addition to the decreased number of participants who chose either the no or somewhat confident categories. Next, for Objective 2, we looked at participants' ability to correctly identify and rank sugar content in beverages. Overall, we saw improvements across most categories, with the largest increase in correctly identifying drinks with the lower sugar content. There was a slight decrease in accuracy in one category, which may suggest some confusion between similar beverage options. However, the general upward trend suggests that participants became better at recognizing hidden sugars, especially in drinks that are often marketed as healthy. This is important because sugary beverage consumption is strongly linked to childhood obesity, so even small improvements in awareness can have meaningful health impacts.
Thank you, Taylor, for walking us through the first couple objectives. Now for Objective 3, we're going to be evaluating the participants' ability to identify key parts of a nutrition label. We saw strong improvements across all areas, especially in identifying serving sizes and healthy nutrients. Understanding serving size is particularly important because it directly affects how people interpret calorie and sugar content. Overall, these results suggest that our intervention improved foundational nutritional literacy. Finally, for our fourth objective, we looked at how well participants could classify nutrients like calcium, fat, and carbohydrates as low or high dietary value. We observed consistent improvements across all categories, and while the percentage increases may seem modest, these results may suggest that participants were beginning to move beyond recognition and toward more comprehensive thought with application of a simple learning tool. This is an important step in supporting long-term behavior change and healthier decision-making. Alike to any project or research, we did encounter several obstacles. One of the main challenges was coordinating schedules and maintaining consistent responsiveness amongst participants. Additionally, the format of our survey and the time constraints of platforms like Qualtrics had restricted our embedding of the video itself into the survey. Instead, we were able to revert to including a direct link to the video that was published on YouTube. This did lead to a loss of about 4 participants. We also were limited by time, which affected how in-depth our intervention and follow-up could actually be. Ethically, we have a responsibility to complete the research that we begin. We wanted to ensure that the level of impact we hoped for was appropriate, accurate, and not left incomplete. Despite these challenges, we were still able to implement a meaningful and effective educational intervention.
One aspect that we did well was keeping in mind the cultural context of our target population. We implemented our intervention in both English and Spanish since the community has a high percentage of people with a Hispanic background. Furthermore, we interviewed doctors who were familiar with our targeted geographical areas to learn more about the community's level of health literacy and specific barrier to proper nutrition intake in children and adolescents. This increased the strength and relevance of our needs assessment while keeping inclusive cultural values at the forefront of our intervention. An additional strength of our intervention was our expansive reach. We were able to make the pre and post surveys accessible by using Qualtrics, an online platform. Our nutrition education video was also viewable by a large audience since it was uploaded to a broadly available resource, YouTube. We were also able to partner up with Ms. Padilla, who connected us to the faculty of Bravo Medical High School, allowing us to distribute our intervention to parents and guardians of students within SPA 4. All of these factors meant our project could reach as many people as possible. One area of improvement we wish we could expand on our intervention is by adding an in-person component as well as longer-term follow-up. For example, seeing the impact of the tool we implemented in weeks to months following the intervention could provide farther insight into this project. Having an in-person component will help make it more impactful and provide an opportunity to answer real-time questions. Furthermore, in-person session would allow for immediate feedback for participants, potentially strengthening our intervention and long-term applicability. This would help us understand the sustained effect of the intervention and create further opportunities for education while simultaneously identifying gaps in our research. To summarize our project, we want to focus on empowerment. First, we have a call to action for parents and guardians, empowering the guardians to take part of their own decision making for the betterment of nutritional decision impacting their family and especially their children. Next, we have a call to action for us as a class. Our intervention does not stop here. As individuals who are equipped with this working knowledge, we can play our part by educating in clinics. Sharing the basic nutritional health literacy can potentially go a long way, as teaching one teaches many. Overall, let's take today to focus on how early empowerment supports lifelong eating habits. Finally, we want to express our sincere gratitude to our community partners listed below. And thank you all for listening to us. Please let us know if there are any questions that we can answer.